Well, COVID-19 continues to expose society's deep inequalities in South Africa and around the globe. In South Africa, women have been subjected to severe economic and social impacts from the very initial lockdown. To look at the extent of the impact on women in Gauteng, we're joined now via Skype by Dr. Alexandra, a senior researcher at the Gauteng City Region Observatory. Doctor, thanks very much indeed for talking to us. Earlier on in our lockdown period, we had this CRAM study which really exposed and revealed the casualties, or exposed that women were the biggest casualties of COVID-19 in the lockdown when it came to job losses, when it came to livelihoods. Presumably from your new insights, very little has changed.
Yes, our research has focused on the COVID infection data from the Gauteng Department of Health, and that's showing that in addition to the economic burdens that women are facing, they may also be more vulnerable to contracting COVID-19. So our data is showing that that more women are testing positive for COVID-19 in Gauteng, and that this is also supported by hospital admissions data, that more women are being admitted to hospital.
And looking into the reasons for that, it's quite interesting because there's some fascinating insights. The reason for the higher rates, you would argue, are typically because of the very different social conditions that women in particular are subjected to in society.
So, yes, we need to consider both the gender-based aspects of COVID-19, those that we would consider to be the social, behavioral conditions, as well as the sex-based differences, the physiological or biological differences between the sexes. And our current data, our most recent death data for South Africa suggests that male mortality is still higher in South Africa. So women's vulnerability to contracting COVID-19 isn't necessarily resulting in a higher death rate. And that would be something that would be related to sex-based differences. Whereas the gender-based differences are something that we explored in our research, trying to understand how women may be more vulnerable to contracting COVID-19. So these differences might be, for example, the fact that globally 70% of healthcare workers are female, and so women are more exposed as part of their frontline care work.
Yeah, that's one social factor that could play a part. But I see you've mentioned another very interesting one, is that when you look at the recipients of social grants, many of them are women rather than men. So typically you would find more females or women standing in these long queues and, of course, exposing them to the virus, perhaps.
Yes, that's one aspect, and it's something that's a little bit more difficult to research at the moment. Sort of current behaviors that might be influencing COVID-19 transmission. So we need to do more research. But at the Gauteng City Region Observatory, we looked at our most recent quality of life survey data, which was conducted in 2017-2018, to try and understand some of the behavioral aspects that might still be at play. And so we looked at various factors that might be related to COVID-19 transmission, such as living in crowded dwellings or use of public transport or the reliance on public health care. And this data points to some of the factors that might also be making women more vulnerable, such as the fact that women are more likely to live in larger households and live in crowded dwellings, and that may make it difficult to practice adequate social distancing. More women also use minibus taxis as a form of transport, and this might make them more vulnerable to contracting COVID-19. COVID-19 as they have been returning to work. And this is one major difference in South Africa compared to other countries that have higher proportions of female infections. In South Africa, we're seeing that it's working age women, aged 20 to 65, that are more vulnerable to being infected. Compared with in other countries where it tends to be the very elderly age group where women are more infected.
Just finally, how does the national and local governments here really use this information when formulating their response to COVID-19?
So rather than needing specific gender-based interventions, what would be useful would be to ensure adequate protocols are observed and enforced in spaces where we know there are more women. So, for example, ensuring that passengers and drivers using minibus taxis are wearing their masks and keeping windows open, ensuring that there's adequate protocols in queues for social grants and at healthcare facilities where we know that women may be accessing healthcare for themselves and for others in their care.
All right, thanks very much indeed. That's where we're going to have to leave it. Time's against us.